Hi, and welcome to Kidney Plugged In. November is National Diabetes Month. And because diabetes is the leading cause of kidney disease in Canada, we are pleased to welcome back nephrologist Dr. Kiaii to discuss how diabetes affects kidney function and the correlation between diabetes and kidney disease. Dr. Kiaii also discusses ways to help prevent kidney disease and healthy lifestyle changes that can help kidney patients on their journey living with kidney disease. So stay with us because you won't want to miss this discussion with Dr. Kiaii, and it's coming up next right here on Kidney Plugged In.
Thank you for joining us today, Dr. Kiaii. It's such a pleasure to have you on the show.
Thank you for having me. It's a pleasure to be here.
So can we talk a little bit about the correlation between diabetes and kidney disease?
So as many people know, diabetes unfortunately can have a lot of different complications. So we always refer to it as you can have small vessel involvement because of the blood sugars being elevated. It can damage the little blood vessels, and you can also have big blood vessels affected. So when people have big blood vessels affected, they're at risk for getting heart disease, which we know people with diabetes are at way higher risk of having heart disease than someone who doesn't have diabetes. Similarly, the small blood vessels can get affected. So the eyes can get affected, where people will have problems with their eyes and they can require laser treatment of their eyes. The same small little blood vessels are in the kidney, and so therefore the same little blood vessels get affected with the diabetes. And so the better your diabetes is controlled, the less the high blood sugars are occurring, the less damage those little blood vessels will affect. So there's an absolute correlation with having diabetes and how well it's controlled, and how these organs that I mentioned and the kidney getting involved. So people with diabetes, if the kidneys start to get involved, usually the first signs is they start to leak protein in their urine. And that's why all diabetics should have routine screening of the urine for protein leakage, because that's the first sign that the kidneys are getting, that little blood vessels are starting to get damaged. And there's lots we can do to reduce that damage with good blood pressure control, making sure the sugars are well controlled, and implementing medications. So blood pressure medications like ACE inhibitors or angiotensin II receptor blockers specifically work in that area and reduce that pressure, reduce the protein leakage. The SGLT2 inhibitors, they reduce it. And now we know that medications such as Ozempic, which is used for diabetes, can also help with reducing that pressure as well, and hopefully reduce the protein leakage. So there's lots you can do. So absolutely there's a correlation. It's important to screen early and start to do something about it early to prevent that damage from occurring.
Are there any specific symptoms of kidney damage that are linked to diabetes, or is it the same no matter which disease causes kidney disease?
They're usually the same, but people with diabetes usually develop symptoms earlier. So often we have to implement the interventions that we do a little bit earlier in their percentage kidney function. And often people with diabetes will require to start dialysis a little bit earlier. They just get their symptoms develop a little bit earlier and then tend to be a little bit more pronounced. So that's the one thing, but it's usually the same symptoms: water retention, not able to get rid of that, ankles starting to swell, feeling short of breath, and then feeling tired and not having the same energy. So those are the things that we still see with diabetes. And the other thing that I think gets a little bit more complicated with diabetics is that as part of kidney disease, you can get some nerve damage and get what we call peripheral neuropathy, but obviously diabetes as well, because of the small blood vessels affecting the nerves, can get peripheral neuropathy. So then their peripheral neuropathy can be a little bit worse than the person who doesn't have diabetes. I do want to stress again that I'm not sure if people fully understand the importance of checking that urine protein, because I will have patients who will say, but my GFR is 70%. I'm okay. I'm not at a high risk for getting worsening progression. But then we tried to tell them, but you're leaking a lot of protein. And that tells me that you are going to progress. We recently have a new way of calculating the risk of progression over the next 2 to 5 years. It's called the kidney failure risk equation. So we put in parameters into this equation, into this formula, and it tells us what's your risk of requiring dialysis in the next 2 years or in the next 5 years. And when you plug into this formula small amount of protein, your percentage risk is very low. If you keep everything else the same, including your GFR, but put in that your protein leakage is higher, your risk doubles, triples. So the protein leakage is very important, and often people focus on what's my GFR, but they should also focus how much is my protein, what can I do to help to reduce the pressure inside the kidney artery so that can reduce the protein leakage. And that's especially important in diabetics.
And is that true for other people as well?
Absolutely.
If they're having large protein leakage?
Absolutely,
so
yes.
Definitely
yes.
something you should be paying attention to seriously then.
I feel that when people are told that you have from the blood test pre-diabetes, it's a beautiful opportunity to know early that you can make a change, right? So instead of being told, you're diagnosed as diabetes already based on the criteria and what your blood test shows. If you're at the pre-diabetes, that's when you can make the change. That's when you can actually really prevent from having, some of the damage that occurs quite early on when you have diabetes. So making sure you get the exercise. It's amazing how much you can actually bring your blood sugars down by doing regular exercise, walk after a meal, and obviously changing your lifestyle habits and your diet, and making sure that you get out of that pre-diabetes zone. But that is like a beautiful opportunity to know that information early so that you can make a change.
Are there other lifestyle changes you would recommend for managing diabetes?
So the important is the diet and the exercise, obviously most important. And I do think it's important to just be knowledgeable about what is the healthy diabetic diet. Sometimes I think we don't get all that information properly. So I usually do refer people to the sources, and I make sure that they go to a diabetic clinic, because it's very important to see the dietitian and speak to the experts about how do I manage my diet moving forward, and that's proper for me. So I still do believe that the most important thing is making sure that you do have a proper exercise routine that you're able to do and that is regular, and that you have a good diet. And that you're speaking to the right experts.
I did hear from a kinesiologist recently that you can actually do the exercise in your chair, and it's just as effective, especially if you're unable to walk. Or I know diabetes, there's a lot of amputations that happen and those kind of things. So that was a very interesting comment for me to learn.
Yes, that's actually a very good point you brought up, because most people always associate, I can't go for a walk because I have this issue or that issue, but you can do so much even in your bed, right? So we have patients on dialysis lying down because they can't really sit up because they have issues with this or that, and they exercise with one of those little bikes in the bed. So there's lots of things you can do sitting in a chair. But as you know, as you're providing some of these information for patients, it's important to link into those things and see, okay, what can I do? What kind of small exercises can I do? Even a small little weightlifting that you can do with little ankle weights while you're sitting. But yeah, incorporating that into your lifestyle early on and keeping that up. Even for patients on dialysis, they do much better when they don't have that muscle loss, the sarcopenia that we refer to. They do way better. They have way better outcomes if there's incorporated exercise, resistance exercise into their lifestyle. So it's very much encouraged, and it helps your mental health, as we mentioned.
Absolutely. Is there anything else that we haven't asked you would like to share?
I think that, having been in kidney care for a long time, I do feel that it's very encouraging, and it makes me very happy to see that there's so much new opportunities for patients to be able to get education early on, change their projection of their kidney disease, and steer it themselves, right? And having that control more, and so many more things available that can help to reduce the progression. And then, being hopeful that it's not the end of the world if the kidney function is. There's so many new options as well at that point where you can still travel and do dialysis, and you can have options for transplantation, and dialysis can have all these different ways that you can do it. And as long as you're able to be open to those options, your life can still be very fulfilled, and you can do all those things that you like to be able to do. Because a lot of times I think I've heard in the past that people feel that, okay, well, if I start dialysis, then my life is over. I can't travel anymore. That's not true. All those things are available. All those things are possibilities. And we want to be able to work with our patients to make sure that they are using all those opportunities. So I do feel very much more positive that we're able to offer all these different opportunities now to our patients.
Hi, I'm Joshi, and welcome to Did You Know? Did you know November is National Diabetes Month? This is a time when communities across the country team up to bring attention to diabetes. But did you know that there is a link between diabetes and kidney disease? Diabetes, in fact, is the leading cause of kidney disease. So how does diabetes affect the kidneys? Diabetes damages the blood vessels. High blood sugar clogs all the blood vessels, including the filters of the kidneys. This may contribute to decreased kidney function. Diabetes does damage to nerves and infections. High blood sugars can also damage the nerves that tell you when your bladder is full. A full bladder can cause the urine to back up into the kidneys and cause further damage to kidney filters. Also, those with diabetes may have a high content of sugar in their urine. This can encourage the growth of bacteria and kidney infections may occur. If you have diabetes, did you know there are ways to support your kidney health? And these include talking with your doctor or nurse about what your target blood sugar levels should be and when and how often you need to check it. Testing your blood sugar as often as directed by your healthcare team to ensure you have control over your blood sugars. Maintain a healthy lifestyle and weight. Visit the Kidney Wellness Hub at kidneywellnesshub.ca for important tips and information to help achieve your goals. Control your cholesterol through proper food choices, and if you're on medications, make sure you take it as directed by your doctor. Manage your blood pressure. High blood pressure is the second leading cause of kidney disease, but having kidney disease can also cause high blood pressure. Take special care to have infections treated immediately. Please, please don't smoke. And make sure to have your kidney function tested annually with an eGFR test. And now, you know.
So can we talk a little bit about prevention and lifestyle? Are there any lifestyle changes people can do to help further damage from happening in their kidneys, like diet, exercise?
Yes, I think that is very important. And I think that we're hoping to put more and more focus on the preventative parts. So making sure that you have a good diet. So diet is very, very important. You know, foods that are highly processed are going to give you all of the salt and the phosphorus and things that are just not good for the body. So diet is very important, making sure that, you know, it's a balanced diet. People always ask about protein. Oh, I'm not supposed to eat protein. That is not what we say, because obviously your body needs protein, but it's important to have a balanced source of protein. So more and more information and recipes are coming out so that we can use plant-based protein. There's lots of amazing options about getting protein through plant-based foods. So making sure that the diet is just balanced, so it's not heavy on the animal products, that we do have some plant-based proteins, and just making sure that, you know, the right amount of vegetables and just healthy food. There's lots of resources out there. I always refer people to the BC Renal Agency website and to go and look at the diet parts, and there's lots of good recipes there. So kidney-friendly diet, which is honestly just a friendly diet, right? It's good for your heart, it's good for your blood vessels, preventing strokes, preventing heart attacks. It's the same thing. So making sure a healthy diet, and then making sure that you do have some exercise as well, so that even if it's just 30 minutes of walking, it doesn't have to be major exercise, but incorporating that into your daily lifestyle is very, very important. and just making sure that you follow up on checking on certain things. You know, we're often like, oh, my blood pressure is only borderline elevated, and that's just not good. So making sure we get onto, you know, in charge of that. And sometimes by just improving your diet, reducing, getting some more exercise, blood pressure improves, and you may not even need medication, but making sure we stay on top of that. Those are the big preventative things.
We often get calls here at the foundation about diet and confusion, right? And people are scared. Can you talk a little bit about when it is that patients would have to start managing potassium and phosphorus, and at what percentage perhaps that would be?
Very good question. So when we talk about phosphorus, sometimes high phosphorus diet is because there's a lot of preserved foods that's in the diet, and that should be prevented from right at the beginning, because that's just going to cause damage no matter what. But then there's phosphorus in healthy foods like dairies, nuts, some vegetables that are higher in phosphorus, and that's okay. Becomes more of a problem as the kidney function starts to drop below 20%, is when the kidneys are having difficulty actually now excreting that phosphate load. So that's when, you know, we like for patients to have access to dietary counseling so that we can say, okay, keep eating a little bit of this, but maybe you're having a bit too much of this other thing. Maybe we need to cut that down a bit because your phosphorus is starting to go up because the kidneys just can't clear it. But it is important to have dietary counseling because you don't want to reduce some of the really healthy foods. Definitely get rid of the preservative type of high phosphate foods. Potassium, again, it's different with different patients, but usually, again, when your kidney function drops below the 15% and the kidneys are not able to do the balancing is when you need to start to look at potassium restriction and watching that. Some people a little bit earlier at 30%, depending on what type of kidney disease they have. Sometimes people with diabetes have certain condition in their kidneys and they cannot get rid of the potassium as well. Or you're on medications that are good for you and are important for you. Some blood pressure medications retain potassium a little bit. That's just one of the things that happens with certain blood pressure medications. We don't want to get rid of that blood pressure medication because it's good for the kidney. So then we have to make sure that there's a little bit of dietary restriction of potassium. But again, under dietary counseling, because so much good food does have potassium, it's just we don't want to go too much on one side. So that's usually when people start to need to be restricted a bit more, usually when it's less than 20%.
So you mentioned BC Renal as a resource. Are there any other resources you might recommend to the kidney patients to access for advice or support, especially on diet and exercise, even mental well-being and socially connecting?
There is a number of different websites that people can look at for, again, just looking at healthy diet. So I usually tell people to first go to the BC Renal Agency website, and then after that maybe go on to some other dialysis websites and just look at, like, you know, recommended diets, or, you know, some sharing of like information between patients, because sometimes that can even be more valuable. So usually I just tell people to Google it, and because some people find it difficult to just go and access other things and rather than just using the internet. But there is a lot of websites that do actually give some general, not too detailed, but good information about, you know, what are some foods that, you know, how do you prevent salt? Maybe add these kind of spices that would give it the same flavor, but now you don't have to use salt, sodium. Don't replace salt with potassium because that's now going to cause a problem. So, you know, maybe replace it with some other spice stuff. So I think that there is a lot of information out there, but that's usually the first places that I tell people to go to, not to give them too much.
Fair enough. And I know you're aware of the Kidney Wellness Hub, but did you know the Kidney Community Kitchen has been around a long time, supporting patients with recipes and tips, as well as access to dietitians? They can submit questions. I'm
glad you brought up, because I don't think everybody's aware about that, so that to be able to refer people to this site. So, but I definitely will moving forward.
Perfect. That's amazing.
Have you checked out the Kidney Wellness Hub? We're excited to share this new online kidney community engagement platform created for kidney patients and caregivers. It offers tons of kidney customized resources and tools to support you on your health and wellness journey. We know living with kidney disease can be challenging, and anyone trying to stay active knows it can be overwhelming to start. But you are not alone. There's information, video content, and resources designed to help you stay active. Classes at various energy levels include yoga, strength training,
flat on the wall,
cardio,
make it fast,
Pilates, dance, and more.
5, 6, 7, again.
Plus, we have chair classes for anyone with mobility issues. Many of our instructors are also affected by kidney disease. They get it, and they bring this personal experience to their classes. We all know eating well is important, but making good food choices is hard, let alone kidney-friendly food choices. Sometimes we just need a little help and inspiration in the kitchen. Our Eating Well section is a great place to learn about kidney-friendly nutritional options wherever you are on your kidney journey. Be sure to check out the Kidney Community Kitchen with meal planners, cooking demos, kidney-friendly recipes, and don't miss the opportunity to test your cooking skills in one of our live cooking classes. In this section, we've put together some tools and resources to help you boost your mental well-being. There's a meditation series with breathing exercises, techniques on how to build more laughter into your life, and how to benefit from music therapy, to name just a few. Don't miss our free kidney wellness coaching sessions to help support you to make those positive changes in your life. And key to your well-being, you told us you wanted to talk with others, to share lived experiences and meet new kidney friends. The Kidney Wellness Hub is here to help. Some of the ways you can connect are talking one-to-one with a peer mentor, joining a networking session, or connecting through our Facebook group. Join the Kidney Wellness Hub today. It's easy and free. You'll get updates to new content and special contests for members. Plus, you'll also receive an online copy of our Kidney Customized Wellness Journal. Don't forget to share your feedback as we continue to build and grow. See you online soon.
Do you ever have your patients asked to speak to a peer? Is that something you recommend? Like the Kidney Foundation does have trained peers, but is that something that patients are requesting?
I think it's a very important thing to do. I don't think enough people ask for it, so I think we should be much more forthcoming to obviously offering it and encouraging it, because a lot of the times people are afraid of doing home-based therapy. But as soon as they speak to a peer, it's, their fears are relieved and they think, oh, well, this person can do it. So I think it's a very, very important thing. So we try to encourage it as much as possible, but it makes a big difference in terms of how they would be able to make their decision, because they can see that, somebody else in their position, and maybe even with some more physical barriers, are able to do it at home, right?
And are there any side effects from stress on the kidneys? Or any techniques you recommend, if there are?
I believe that there's so much data about different things that stress will do to your body. Decrease its immune system, increase your blood pressure, just decrease your ability to tolerate different changes that's happening. So decreases your resilience. So I do think that stress overall does affect our body in various different ways, and I believe that it definitely would affect your kidneys as well, but through those different mechanisms that I was mentioning. Because I feel like when people have stress and they have stress, then they're often not looking after themselves all that well either. So those things will inadvertently cause kidney issues as well.
As a busy nephrologist, do you experience stress? Do you have any techniques or tips that you would share?
Very good. question. So I think the three main things, yes, I have a lot of stress. And so my main thing is exercise. So I feel that people say, oh, you're trying to exercise to do this or that. No, I do it for my mental health and for decreasing the stress. And I noticed that as soon as I miss doing some regular exercise, my ability to cope with different events that's happening, being able to be there for my patients and being able to be patient, it just becomes decreased. So I just make sure that I do, even if it's just 20 minutes in the morning before the day starts, I try to do a little bit of exercise, a little bit of biking in the morning. So exercise, and then also maybe taking time to do some relaxation, meditation with it, but doing stretching and those things, I think that decreases your stress, helps with your blood pressure. Actually, it does help with your blood pressure. So I do believe that doing that and having a good support system. So I have a lot of great colleagues and people that I work with that I think help me stay also mentally healthy. So I think that's really important. It's for people to have a good community that they can, share things, share their concerns, and not feel alone. So I think that's important. Those are my top three things that I do.
Well, thank you for sharing those. Those are always important to learn how you manage, because you have a lot more on your plate than we do sometimes. Well, thank you, Dr. Kiaii, for joining us today. It was such a pleasure. I think I even learned some things today.
Thank you, Teresa. I can't tell you how honored I was that you asked me to be able to do this. It gives me great pressure to see if I can give any kind of help to our kidney community. And I am so impressed with all the work that you and the rest of your team are doing with the Kidney Foundation. So again, thank you so much. It was an absolute honor to be part of this.
If you or a family member are at higher risk of developing kidney disease, we invite you to explore the Kidney Wellness Hub with customized tools and resources designed to help you preserve your kidney health at kidneywellnesshub.ca. Hope to see you there soon.
Can I interrupt for a sec?
Yeah.
Teresa, I don't know I noticed your shot is getting darker and darker.
Oh, it is because the sun is going down and down. Is that worse?
That is worse.
I'm not important in this.
Yeah,
so
the light
You're
on
very
it's like
important.
too bright.